Hi everyone, this is Dr. Kusuma from Surya Cosmetic Surgery. Again, it's Thursday morning and I've made it a habit, at least for the last 2, 3, 4 weeks, to shoot a video about some content based on the type of consult I'm seeing. It just so happens that a lot of the consults I see are face consults and neck consults, sometimes nose and eyes, because that's what I specialize in as the face doctor and face doctor of South Florida. I, of course, do some breast as well, but we'll do it for another day. So today, I wanted to discuss, because there was some confusion in a patient's consult, what is a facelift versus a neck lift? And can you do a neck lift of its own merit without touching the face? And so the question really the patient asked is, which I thought was important to, I guess, make it more public, because it's probably a question that many of you have. Is it possible to work on the neck separate from the face? Or does the face, jowl, neck have to be done together? Is there any reason for that? That's what I want to focus on today. So if you look at this drawing that I just put together, this is the jaw. This is basically the jaw that I drew from a frontal view when you're looking directly in the front. This part in the center of the neck right here, if many patients look at themselves, you'll have, as you age, these bands that show up here. They kind of go in a very slight angle like this, and they go all the way from here, all the way to your collarbone to the sides here, right next to the notch that you can feel, okay? So that's how it looks for most people. And then this muscle, essentially, which is what I drew in black here, is a broad sheet of muscle that goes all the way to the side of the neck, all the way to here. And then this thing that we feel when we move our neck, this is called an SCM muscle. I don't want to go over the long-term version of the name, but you can call it SCM. This is that. They're along the side here on both sides. So if I were to orient you again, this is going to be basically the collarbone area right here, like this, and with the notch here in the center. Hopefully that's clear. This center part that I drew in a regular shaggy way is this part where people have fat that resides underneath this muscle. I just showed it so that you can visualize it, but this is underneath that muscle, not on top of it, okay? This other line I drew here, like this one here on top of the blue, is the fat that is on top of the muscle, okay? So you can imagine two separate compartments like a lunchbox. There's a top one and there's a bottom one, and separating two different food items, as an example. No pun intended, it's fat and food, I guess they go together. Just thought of that. But anyway, so this is the fat that is more solid, more stringy, fibrous in nature, and that is underneath these two neck bands, which can give you puffiness and fullness and create a lack of definition, or erase a good defined neck if there's too much of it. All right. And then this other fat that sits on top of the muscle, which is also fat, which is a different characteristic. It's more softer, more supple, and different looking altogether, sits on top of that platysma muscle, which is that sheet with the blue lines all across the neck like I just showed you. Okay, that's what I hope you can see and understand very clearly. So if you think about all these minimally invasive procedures that do liposuction, you can remove only the fat that is on top of the muscle. You cannot remove the fat underneath this compartment at all. I've shown this in some videos, which are somewhat graphic on YouTube sometimes, but just so that visually you can understand this. So liposuction will not remove this central portion at all. It can remove the top of it, and this top muscle, fat goes all the way across. So you will get some thinning, obviously, if you have too much of it. But the bad thing is you'll also get exposure of these bands sooner than later, because now that you've removed that barrier between them, they're going to be visible at a younger age to the people who have had liposuction aggressively done at a younger age. So short term, it may benefit by thinning it out, but long term, it's going to be bad because the bands are going to be very, very visible because you don't have that buffer of camouflage, and you're going to show that sooner. Okay? So when you do a neck procedure, right, you can also make an incision right here underneath the chin, a small one, And through that, you can liposuction, you can remove this, and you can do and tighten up these bands here like this. These bands can be unified by tightening it up, which I've discussed before. But there's skin as well, right? It's just not fat. There's a lot of skin looseness because people can grab it and pull it, and they say, well, all this skin just hangs, it shows through the neck. I can't wear anything because I just have so much extra skin, and they just hate it. And that's where the aging of the neck shows all the time. You know, especially if you're like this, it just hangs and it looks terrible for a lot of people, and that's one area that it ages a lot. And the jowl area, which is this area here, further aggravates that because the jowl will blend into the neck, and that all looks like one undefined excess tissue and excess skin. So is it possible to do just a neck lift alone? Well, the neck lift alone has 3 components to it, right? We talked about the fat in the center that's behind the muscle. We talked about the fat on top of the muscle. We talked about unifying these bands, right? And also you have to tighten the bands on the sides as well, like this, on both sides. So you're essentially taking this, you're unifying it in the center, you're stretching it out so the neck has a very tight definition, and that has to be done. And then that's the deeper muscle work, right? Muscle and fat work. Then what do you do with the extra skin? Well, if you don't cut the skin out and remove it, you have to somehow figure out what you're going to do with it. Some devices that are available can create an injury that shrink it, but when you do neck lift surgery, the goal is to, tighten up the skin and trim it and, discard it or throw it away so that you get that skin tightening as well, right? So not just the undersurface work, but also the skin work. And how do you do that? Well, you have to remove the skin by making incisions behind the ear. So if this is the ear, the incisions are made behind the ear in front, and then it kind of goes across the back of the head. So if I can show you here, it goes behind the ear, and in some variation, it's going to go into the hairline right here, because when you pull this extra skin up like this, it's going to be excess, right? You can almost get 2 inches of skin in many people. That's a lot of skin. From the side view, if I were to stand like this skin, this incision that's made to, elevate all of this extra skin, you did all the work here. That skin now has to be stretched out, and then that stretched out skin, to make it look natural, is going to come in this direction, exactly the way it should go. Not in this direction, not in this direction. It has to come in this direction right here, almost like my palm. And you have to stretch it and to see how much extra there is, and then you have to trim that excess skin. And in many cases, it's about 2 inches on each side that has to be removed. And the only way that can be removed is to dissect the whole neck. So that's a last step of the neck lift surgery. So you can imagine, if I just do the neck and pull it up like this, you're going to get bunching in front of the ear, right? I mean, if I'm taking all of this contiguous skin and I'm only pulling this very, very tight, you're going to get bunching in front of the skin, and this jowl is not going to be better, and you're going to actually make the face worse, okay? So what you have to do is, to make it look natural, you have to move this up and you have to move this up, both of them together, right? And then the ear is basically going to split these 2 sheets of skin that go up so that it goes back to look natural. So the incision for even doing a neck lift properly will have to be on the ear, and right on the ear, behind the ear, and into the hair, so that this skin can go up, this skin can go up, so the entire area looks very natural. If you don't do this part with the neck lift, which some people do, where they just put an incision back and do a little bit of work, it is never going to be good. It is like, in my opinion, again, other people may disagree, but it's like a very cheap, bad shortcut. And well, some people argue, well, I don't need that much, but you will be surprised. Even in 30-year-olds, even in 40-year-olds, I could remove 1 to 2 inches of skin on each side. That's 4 inches of extra skin. Once you dissect it, that's how much laxity people can have. Okay, so the once all of this work is done, the skin is stretched out here like this, and when you stretch it out, this is the incision. All this extra that's sitting up, you trim it, you throw it out, and then you can stitch it up here, which hides very nicely, and you do that on the same thing. Same thing in the face. The incision in the face goes in front of the ear like I showed you, and the extra skin goes up like this. You trim out the excess, and then you suture it back so that it hides very, very nicely. So can you do, after all of this explanation, can you really do a good neck lift by just focusing on the neck? In my opinion, not well enough. In my opinion, not naturally enough. In my opinion, not long term enough. In my opinion, not thoroughly enough. But can it be done? Yes. But you have to know that whatever you do, you're going to have to live with the results that it's capable of delivering, assuming that the surgery is done as thoroughly and as well as possible. So I just want to make sure that there's clarity on what it is that is being done, what procedure is done, what are the implications of that, what can it actually accomplish, etc., etc. Another important component I want to make sure that people understand in my consultations is that skin in general is not designed to hold tension. When we're born, skin is just a natural covering. It's not tight anywhere. It's just naturally just sitting and covering whatever there is. As the skin relaxes and ages and loses all of the components as we age, we cheat in a way, because when we are pulling it tight, we are making everything unnaturally, well, I shouldn't say unnatural, but we're removing all of that laxity, and in some cases it does get pulled tight. So as it relaxes, it goes back to a natural state, right? That's what I'm trying to say. And you have to also remember that the worse sun damage somebody has, the worse elasticity the skin is going to have. And no matter how tight you pull it, it's not going to be able to hold that tension forever. And it's going to give a little bit. And in patients who have had very bad sun damage, it's going to give more than people who don't have sun damage, who can retain the results much, much longer than somebody who has had, bad sun damage. There's a very wise professor back in the 70s, 80s who used to always say, I do double surgery on some patients. From the get-go, I tell them, because their sun damage is so bad that even if I do the best job possible and remove 2, 3, 4 inches of skin or more and do all the muscle work and the fat work, sometimes they loosen up a little bit, and then I have to go back and retighten it, because that extra looseness I cannot take out in the first case, so I have to go back and do a little bit more. But a few small percentage of people who will need that. So this is what I wanted to talk about, the neck lift. So the answer for the question that was asked this morning is that, can you do a neck alone? The answer is yes, you can, if the only problem is here, where you can remove the fat, you can do some liposuction, you can tighten up the bands and be done with it, because there's not a lot of loose skin, because these patients may be young. You can definitely do that. But in otherwise older patients, so 50, 60, 70, there's a lot of loose skin. And when you have the loose skin, the best way to take care of it is to do what we call a lower face neck lift, where the skin is tightened here, the skin is tightened here, the muscles are tightened here, the muscles are tightened here, the fat is worked on, all of it's done well. And so that's my long and short answer for that question. Hopefully that's helpful. If you have any feedback, comments, please post it on YouTube, and I'll be happy to respond to them. Thank you and have a good day.